Hey everyone, and welcome back. We're diving into a topic today that's near and dear to many of you, especially if you're in that exciting, kind of overwhelming first trimester. Figuring out your birth team. We're breaking down the roles of OBGYNs, midwives, doulas. We're going to dig into your research to help you find those answers, give you the knowledge to build a birth team that feels right for you. And listen, while we're navigating all this, insurance. Whole other story, right? Definitely connect with your provider to get the specifics on coverage because that can play a big role in your decisions. But for now, let's start with, I guess, the familiar face in the pregnancy world, OBGYNs. They're like the medical captains of the pregnancy ship, right?
Yeah, spot on. They're the ones with the years of specialized training in everything, pregnancy and childbirth, routine checkups. That's them. Managing any complications, they're on it. And of course, being there for the main event, whether it's a vaginal birth or a C-section.
They're the quarterbacks, making the calls, overseeing the whole 9 yards.
Exactly. And you know, it's interesting. Lots of OB/GYN practices these days are bringing midwives and family medicine doctors on board. So even if you're set on having an OB, you might still have different care options within that same practice.
That's cool. It's like a one-stop shop. But speaking of midwives, what's their deal? They're not MDs, but they're not just about good vibes either, right?
Right. Certified nurse midwives, or CNMs, they're the real deal. They graduate from nursing programs, then go on to get a master's degree in midwifery. They're qualified to handle low-risk pregnancies, providing prenatal care, labor support, postpartum care, the whole package.
So wait, they can actually deliver babies.
Oh, absolutely. Right. And what sets them apart is their focus on low intervention care. They're all about letting those natural processes happen as much as possible. So instead of automatically going for an epidural, they might suggest things like a water birth for pain, or moving around trying different birthing positions instead of just staying in bed. Things like delayed cord clamping, too, which can be really beneficial for the baby.
It's like trusting the body's natural design.
Exactly.
So it's more about letting things unfold naturally with medical intervention if it's truly needed.
Exactly. Now, keep in mind, they're also certified professional midwives, CPMs. They usually train through more of an apprenticeship and often attend home births. It's good to research the specific credentials of midwives in your area.
Yeah, makes sense. Different roles and all that.
Huh.
Okay, so we've got OBGYNs who are all about that medical expertise and midwives who lean into the natural approach. That brings us to doulas. What's their superpower in all of this?
Doulas. They're like your birth support system personified. Emotional support, information, advocacy. They're there for it all. They won't provide medical care, but they'll be your coach, your cheerleader, and your voice when you need it most, especially during labor.
I've heard they're amazing for navigating that whole labor experience, especially when it comes to pain management.
Oh, for sure. They might guide you through breathing techniques, massage, help you find comfortable positions. Plus, they're there for your partner, too, offering them support and guidance so they can be fully present for you.
Sounds like a doula could be amazing, whether you go the OB route or the midwife route.
Exactly. It all comes down to what you want your birth experience to look like, what feels right for you.
So for someone listening feeling a little overwhelmed with these choices, what questions should they be asking themselves as they figure this out?
I think it's all about envisioning your ideal birth. Picture it. Are you in a hospital, all the medical tech at your fingertips? Or are you leaning more towards that natural, low-intervention approach, maybe even a home birth? Getting clear on your comfort level with medical interventions and your overall birth philosophy, that's key.
And it's okay if it's not crystal clear right away. It's a journey figuring it all out.
Absolutely. The important thing is to gather information, talk to other parents, maybe even have consultations with different types of providers. See who you click with. Knowledge is power, especially when it comes to childbirth. The more you know, the more confident you'll feel making these big decisions.
So true. Trust your gut, do your research, and remember, you've got this. And hey, who knows, maybe you'll end up with the ultimate dream team. OB, midwife, and a doula. The more, the merrier. The journey to parenthood has many paths, and you get to choose the one that feels right for you.